Hello, my name is Sandro Graca, and I'm a licensed acupuncturist. I'm a lecturer at the Northern College of Acupuncture in the UK, and I'm also a fellow of the ABORM, the American Board of Oriental Reproductive Medicine. Before I begin, I just want to say a big thank you and show gratitude to Dr. Mike Armour for inviting me to put together this series of short videos with advice, practical, simple advice for women with PCOS, Polycystic Ovary Syndrome. Just as an introduction, what we are going to do in this video first is give a little bit of the background. Say, for example, if you were just diagnosed with PCOS, what does that mean to you? We're going to give you a few hooks, and then from then on, we're going to flesh that out with the advice. I always think that it helps and it makes more sense for the person receiving the advice if they can actually anchor that and know why they are doing it. So that's the purpose of this first video. I'm gonna give you 2 bits of advice already from this video, and then on the next ones, we're going to discuss some of the more practical things that you can do. So let's start. So first, let's start with the name, Polycystic Ovary Syndrome. So syndrome, because it's characterized by a group of symptoms, it's not just one thing, and ovary, because of can be in one ovary, can also be on both ovaries, and polycystic because poly, it's multiple, multiple, and cystic because of the cyst. So that's where the name comes from, polycystic ovary syndrome. As for the prevalence, well, depending on the population studied and also depending on the diagnosing criteria used, it's estimated that the prevalence is around between 12 and 14% is kind of like where you will find the figures to be at. But more importantly than that is that it's estimated that about 70% of women actually go undiagnosed. So what characterizes PCOS? So a lot of the times women will find out that they have PCOS or they will be diagnosed during their investigations because they're having difficulty conceiving. And this is because of one of the main characteristics of PCOS, which is infrequent or totally absent menstrual cycles. The other characteristic that women might find, and sometimes early enough in life, so even as a teenager, is excess acne and even excess body hair growth. And those are in the domain of hyperandrogenism. So that means that there's more androgens, more male hormones than there should be, and therefore they are getting those symptoms. The other one that is really prevalent is insulin resistance and hyperinsulinemia that comes with it. And here lies one of the common misconceptions of PCOS. Only obese or overweight women have PCOS. This is not true. And if you look, for example, at the insulin resistance aspect of it, 75% of lean women with PCOS will have insulin resistance. If you look at the category of overweight or obese women, then yes, there it's 95% of those women will have insulin resistance. But again, body shape, BMI does not have that correlation to PCOS, meaning that only obese women can have PCOS. That is not correct. PCOS can also be found in lean women. Finally, the other big characteristic of it, obviously, is the polycystic ovary, so the multiple follicles in those ovaries. So that is normally detected with the ultrasound scan, and what you will see on that ultrasound scan is that there will be immature follicles, so follicles that never develop to become the dominant follicle and therefore for ovulation. Hence, remember the impact on infrequent or completely absent ovulation. So those are the fluid-filled sacs that you will see on the ultrasound scan. Again, word of caution because of the misconceptions, not all women with PCOS will have the multifollicular ovaries. Remember, this is a syndrome, so it's characterized by a group of symptoms. So you might have one, but not have the other one. One of the first things that I always advise my PCOS patients is to get a book that is available online. You can check it out. It's called 8 Steps to Reverse Your PCOS, and it's by a good friend and colleague of mine, Dr. Fiona McCulloch, who is a practitioner based in Toronto in Canada. And again, look at what we spoke about before. And this book says it's a proven program to reset your hormones, repair your metabolism, and restore your fertility. Again, this is not just because of fertility, but what happens, as I said, is that a lot of the times you find out about the PCOS during investigations because you are trying to conceive. The book includes those 8 steps. There's also some dietary advice in it, lifestyle. Again, main advice being don't try too many things at the same time. If you're already taking medication or if you're seeing the consultant because of the condition, tell them what you're about to try out. Set realistic goals. One thing at a time. Get the book, start reading it, maybe even just read it first before you start anything. And always, always, always set goals. Be realistic on what you want and what you can achieve. The other bit of advice that I would give you right now is go and check out this app. I'm going to put it on screen here. It's called AskPCOS, and it was created by the Center for Research Excellence in PCOS. As you can see, scrolling through the screen of that app, there's plenty of advice there again, things that you can do, realistic goals, lifestyle, dietary. Again, make a plan, give yourself enough time, but always set goals that you can achieve. Remember, you're not alone on this. You have your consultant. If you're going for any other type of therapy, talk to the person you are going to. In my case, for example, I will be using acupuncture and herbal medicine in the clinic, but I would also want to know what other medication you might be taking and just be sure that we have a plan together that I can continue to support you. So, word of caution here, there is no silver bullet. You know that, right? So you're watching this video because you want to know what to do and why you're doing it and how you can set up your goals. Always remember that. There is no silver bullet. It's a syndrome, right? It's complex. It's probably been there for a while anyway, and you only found out about it now. So here's the thing. Sit down, think about what you can do realistically, and let's do this together. I'm going to give you some do's and don'ts. We're going to go through some lifestyle advice with some key points and also some dietary advice. So thank you for watching this video. Let's go to the next video and start going through those dietary advice and lifestyle advice together.